Obsessive-compulsive disorder, OCD, is a chronic mental health condition that can be challenging to manage. If you're suffering from OCD, it's important to seek professional help, as management often requires a combination of medication and therapy. That said, there are certain strategies you can use to help manage your symptoms. Here are 5 steps. 1. Understand your triggers. The first step to managing OCD is to understand what triggers your obsessions and compulsions. It could be certain places, situations, or thoughts that tend to bring on your symptoms. Once you identify these triggers, you can work on strategies to avoid or deal with them. 2. Practice mindfulness and relaxation techniques. Mindfulness exercises like meditation, deep breathing, and progressive muscle relaxation can help reduce anxiety and make it easier to deal with it. Yoga and regular physical exercise can also be beneficial. 3. Exposure and response prevention, ERP. This is a form of cognitive behavioral therapy, CBT, that's often used to treat OCD. It involves gradually exposing yourself to the situations that trigger your obsessions and then choosing not to carry out the associated compulsion. This should be done under the guidance of a trained professional. 4. Challenge obsessive thoughts. Another component of CBT is cognitive restructuring, which helps you to identify and challenge the irrational thoughts that lead to your obsessions and compulsions. A therapist can teach you how to do this effectively. 5. Self-care. Make sure to take care of your physical health. Eating a balanced diet, getting regular exercise, ensuring you get enough sleep, and avoiding alcohol, caffeine, and drugs can all help reduce OCD symptoms. While these steps can be helpful, it's crucial to remember that managing OCD typically requires professional help, and these steps are not meant to replace therapy, medication. If you're struggling with OCD, please reach out to a mental health professional. They can provide a proper diagnosis and help you develop a comprehensive treatment plan.